we'll start with something called a epistemological self-diagnosis. This is borrowed from University of Cape Town and Western Cape CHPSR consortium, and they've called it totally unscientific self-diagnosis. It's not a test, but it's just an opportunity for you to try and think about where your inclinations lie. Do they lie with more the kind of hard science positivist side, or do they lie with the more relativist side, or are you somewhere in between? And we don't ask you for your results. This is more just for you to have a knowledge of yourself. I find that this might be useful because sometimes what we tend to do is we may be actually inclined towards a particular side of the spectrum, but a lot of the questions we are asking tend to be on the other side of the spectrum. So we may actually be a hard scientist at heart, but somehow the questions we are trained to ask are more relativist, or vice versa. We may actually be relativists, but we are somehow trained to ask the hard science questions. At the end of the day, I said the question is the boss in HPSR. The question is what we follow, but equally important is the sort of researcher's individuality and the type of questions that they want to ask. The type of of course, we are driven by the external outside world. We feel that certain issues are important and we should be driven by those things. But actually, at the end of the day, as a researcher, you will only be happy doing what you're doing if you are following your specific interests and inclinations. So I think that is equally important to the outside world. So just try taking this test. Maybe if you all got a computer or a pen, then you can note it down. And if you want to share it, then you're most welcome. But if you want to keep it private, that's also fine. So this is the first question. Which do you trust more, hard science or soft science? So just mark down the question number and the A, B or C, and then at the end we'll tally it up. So hard science is deductive research, proofs, evidence-based medicine, evidence-based policy. Soft science is the social sciences, the non-quantitative social sciences, anthropology, reflections, case studies. Which do you trust more? Okay, shall we move on? Next one. Is there such a thing as truth? I can't decide. B, no, which means there could be no truth or many truths. And C, yes, there is a truth. Is knowledge discovered or created? Knowledge is discovered, both, I can't decide, or knowledge is created. Okay, so done with this one. Okay, question 4. Can we have knowledge of a single reality that is independent of the knower? So, is there a reality out there that is not based on who is looking at the reality? Or does the person who is looking at the reality condition that reality? Okay? Ready? Next one. What is the role of the HPS researcher? Truth gatherer. So are you out there to collect the truth? Are you out there to interpret? Or are you out there to make meanings? Okay? Done? And now you can score yourselves. So for question 1, A is equal to 1, B is equal to 2, C is equal to 3. Done? But the result will tell you. Okay. So anybody wants to discuss their score and whether it was different from your expectation or according to your expectation, or is it different from the kind of work you do or similar to the kind of work you do? Anybody? Yes, Vikas.
My score was 12. I found it to be 12. Okay. So I am heading toward constructivism. Okay. And as I've already explained, I work with health system day to day. So I think I will be able to contribute in a more constructive way by learning HPSR.
But are you all using those methodologies in your normal practice, or are you following more kind of deductive and evaluative methodologies? Okay. You use mixed methods approaches. Okay, great. But constructivists are very rare. I mean, people who actually do follow the wide side of the spectrum. Mixed methods still, you would be a 6 to 11 type of person. So, I mean, I don't know, what is this telling us? That there's so many people who actually believe. There may be, I mean, a whole range of factors here, because I don't think, I think maybe it's just cultural as well. Maybe we are more philosophical or something, so we feel that, these are important considerations actually. Is there some knowledge out there that is ready to be collected, or is it all based on interpretation? That's a philosophical question. We discussed about whether rigour is the sole domain of the positivists. And I think that's exactly what we're going to discuss today. There are different ways of being rigorous, and HPSR has particular ways in which you can think about being more rigorous, which apply across all the disciplines. And of course, there's going to be something that you'll get into much more when you go into the actual horizontals. The basics of rigour are, one is being systematic, and the other is writing everything down. Whatever you do, it should be written down so that you can justify it. I think we really fail at writing down what we do as methodologists. That's one area which we are not really comfortable with. We like to write our results and our findings and our methods, but we don't actually like to write what we do on a day-to-day basis as researchers. I think that practice is also really important. So just memos, notes, all of those things. But we are going to keep discussing this towards as we keep going. So what I'm going to be talking about, first of all, just a bit of an overview, framing the field, what is it really about, and what are the kind of core sequence of steps that we follow when we are developing a research plan in health policy and systems research. And then I'll focus on two key aspects of doing research in HPSR. So of course there are a number of steps in doing research, but I'll be focusing on two key aspects. One is developing a research question, which is of course I think pretty central to what we will be doing. And the other will be, I'll be talking a little bit about concepts of knowledge translation, rigour, and ethics in the context of HPSR. There are other aspects which I will not be dwelling on in detail, particularly study design. I won't be talking about study design too much, and I won't be talking about methodology, actual methodology too much, because those are both aspects that will be extensively dealt with in your respective capsules. So how you design a study, differs a lot based on what kind of approach of analysis you are taking. But however, not to say that there aren't some very basic principles of doing a study design and of of your methodology. So just to repeat, now we are going to be talking about our overview, framing the field, then focus down on the most important thing, criteria for developing a research question, a process for developing a research question, and finally talking about how we think about knowledge translation, rigour, and ethics at the end. So what is health policy and systems research? It's an emerging cross-disciplinary field with its own evolving standards for creating, evaluating, and utilizing knowledge. So not only creating knowledge, not only having its own standards, but it also encourages a different way of thinking about how we utilize knowledge. And that links to the second part here, and a particular orientation towards influencing policy and wider action to strengthen health systems. So it's not research for research's sake. It is research with a particular orientation towards bringing about change. And that's why we need to think about this idea of utilizing knowledge in a different way. It doesn't mean that all of us can implement a completely different approach to how we do research immediately. I'm not saying that all of you should immediately become knowledge brokers and start doing that, because we are also bound by our various systemic and institutional constraints. Most of us, if we work within an academic environment, we'll bound by the norms of the academic environment. But all I'm saying is that look at it as opening of a mindset, as a try and think about it as an opportunity to explore some of these different ways of engaging with knowledge utilization as well as knowledge creation. It's a family of approaches including implementation research, evaluation science, policy analysis, participatory research, and draws from the social sciences and from public health. Okay, so this is from WHO, the recent WHO report. It's a critical element. So the recent WHO, most recent one was on research to achieve universal health coverage. I think that was 2014. So it's a critical element of the action needed to achieve health-focused Millennium Development Goals, strengthen primary health care, and advance towards universal health coverage. And as I mentioned before, it's also known as health systems research, but we prefer to call it health policy and systems research. And just some key publications here, which some of you have read already. And then there is this reader, which is on the website of the Alliance for Health Policy and Systems Research. And there are a number of series of conferences also that happen, global conferences on health systems research. Most recent took place in Cape Town in September, October 2014, and before that there was one in Beijing. The first one was in a place called Montreux in Switzerland, and the next one is going to take place in Vancouver in 2016. So yeah, think about that as a possible opportunity, because that's a place where the whole community, global community of health systems researchers gathers. There's traditionally a very strong Indian contingent. This time in Cape Town there were about 100 Indian researchers who went for that. Health policy and systems research is an emerging field that seeks to understand and improve how societies organize themselves in achieving collective health goals, and how different actors interact in the policy and implementation process to contribute to policy outcomes. So this is the definition that I was referring to yesterday. It's a definition of HPSR that doesn't use the word system even once. So it's saying that any way in which society organizes itself is a system. And it's also making you see, that's why phrasing is very important, wording is very important. It's also saying implicitly that systems are social organizations. They are not machines, they are not outside of society. They are basically the way the society organizes itself, either as markets or as organizations or as different forms of institutions. That's all systems. Or as communities. Even communities are part of health systems. Or as professions. These are all different ways in which society organizes itself. By its very nature, it is interdisciplinary, a blend of economics, sociology, anthropology, political science, public health, and epidemiology that together draws a comprehensive picture of how systems respond and adapt to health policies, and how policies can shape and also be shaped by health systems and the broader determinants of health. It's a bit more descriptive definition. It suggests that, this is also a useful way of looking at it. So policies don't just shape what happens, they also get shaped by existing health systems and the existing configuration. So this definition also combines our understanding of policy and systems in a useful way. This is again something we went through yesterday. Health policy and systems research is a multidisciplinary research field distinguished by the issues and questions rather than by a disciplinary base or a set of methods. So, there's a field called health economics. For me, I think HPSR is also transdisciplinary because it's really focusing on the question or the issue rather than on the discipline, and it sort of transcends the idea of the discipline, because the question or the issue is really more important than the discipline, and the disciplines then serve the master, which is the question. So I think there's various ways also. Let's move on, though. It's a good discussion to have. It's a good thing we can keep talking about. But again, I think maybe making a distinction between the fact that the field is multidisciplinary means that it is contributed to by multiple disciplines. Doesn't mean that every research study has to be multidisciplinary. Includes research that focuses on services but also on the promotion of health in general. And again, by promotion of health in general, it doesn't just mean health promotion as we know it as a subset of public health, but rather everything that goes into supporting health services as well. Includes concern for global and international issues as well as national and subnational issues, as global forces and agencies have important influences over health systems in many low and middle income countries. Encompasses research on or about, instead of we could use the word about policy, which means that it is concerned with how policies are developed and implemented and the influence that policy actors have over outcomes. It addresses in other words, it explicitly addresses the politics of health systems and health system strengthening. So and distinguish that from the last one, which says that it promotes work that explicitly seeks to influence policy, that is research for policy. Okay, so HPSR is research on policy. You can actually research how policies get made and how they get implemented, but it is also work for policy. So it is also policy orientated, it is change orientated. It's eventually done with a view to bring about some change in policies and in actions. Okay, so this is again a repetition of yesterday, but I'll quickly recap it. HPSR is not clinical or basic science, not only rooted in health economics or focused on financing issues, though both are important. I'm saying this is being said here only because they have tended to become a bit dominant within the HPSR domain, so it may becomes necessary to say that. Focused on disease distribution causes, it's not focused on disease distribution causes and interventions, but rather on the generic organizational and societal structures through which the interventions are implemented. So we're not really interested in how how many deaths and how much morbidity and how does disease spread and what are the causes of that, but rather, and not even on what we do specifically to resolve diseases, but rather on how that has a significance in terms of the broader organizational and societal structures through which interventions are implemented. And in relation to that, it can have a, it can focus specifically on a disease or a disease program or a service, but as a tracer for understanding systems issues, or because the program has system-wide effects. But it must think beyond the program or service. Given its multiple perspectives, HPSR embraces a few concepts, core concepts. Complex causality. We don't assume that A causes B, but we assume, and that is an uncomplicated relationship. We can say, we use words like it is associated with this, or it has a significance for this, or it's related to this, or in this particular context it may have a very strong impact on this. But you don't, automatically assume a sort of a linear relationship of causality. To my recollection, we haven't actually said that you can't generalize to higher income countries, and I personally believe that you can actually do analytical generalizability across any settings. I think many of the problems actually, it's not really easy to separate LMIC and HIC issues. But I think in that particular paper, we made a sort of a more like an operational decision to talk about them as separately, and also just reflect on the reality that the field has grown up more in the context of LMIC research, because in many HICs they have existing fields such as public policy analysis, health economics, health services research, which actually deal with a lot of these things, and a lot of the HPSR work has not been done in HIC settings. But this is actually an active area of debate, and many people believe that there should be no distinction. And in fact, in a globalizing world, we should, methodologically, it's important not to make a distinction, because many of the influences are, cross-national, and many of the key dynamics are cross-national. If you look at something like migration of health professionals, you can't separate the pull factors over there and the push factors over here. I mean, it's part of the same dynamics. Right, so when we talk about framing the research field, we ask the following questions. What do we want to investigate? Why do we want to investigate it? What and how can we know about it? And finally, we ask, how do we investigate it? So there are 4 questions we might want to ask ourselves. First, what is the reality out there that we want to do research on? Then, what is our intention? Like we discussed yesterday, the importance of purpose and intention. And we classified based on purposes. Do we want to evaluate? Do we want to know what's going on? Do we want to know why something is going on? Do we want to know what lies beneath? Do we want to create change? Do we want to measure something against a standard? All of those questions, I think, become very relevant. It comes down to your individuality as a researcher. Then this question, what and how can we know about it? So what can we know about? So if we have established there is a reality, right? Whether it's a constructed reality or whether it's an independent reality, that's open to interpretation. Now, once we've established that, what can we do so that we can create knowledge about that? So there's a lot of informal, and there's a lot of maybe things happening over there which are not very apparent, very obvious to somebody outside. Yeah, so it's a hidden practice. Yeah? A lot of the informal practices are hidden because people don't want to share them, because the rationale is something that is not easy to convey. It is also can be associated with negatives, and also the formal rules are different from the informal rules. So how do you access this knowledge? What is the actual way in which can you access this knowledge, and how do you access it? So there are ways in which you can access, but it's difficult. It's different from how you access, say, data about morbidity or mortality. It's different from, say, how you might do, collect numerical data, which is pretty straightforward. Although, I mean, sometimes even collecting numerical data is not straightforward at all. So that question, once we start thinking about that question, that is when the term epistemology comes in. So what is the nature of the knowledge out there, and what can we actually know about a particular situation? And only then do we move into the how questions actually. So what I just preempted it a bit actually. So it's not really the how, is more the methodology question, but really what is the nature of that knowledge? Is it tacit knowledge? Is it apparent knowledge? Is it some knowledge that needs to be collected? And that is the usually the defining characteristic of a lens or an approach. They all have different epistemologies. So I'd just like you to reflect on this slide a little bit. Just absorb it and read it. So one is ontology is what is the nature of the reality out there. Epistemology is what is the nature of the knowledge out there that we can collect. So what is the nature of the social, so these are questions that you ask yourself when you're thinking about your epistemology. What is the nature of the social and political reality to be investigated? What exists of which we might acquire knowledge? There are a set of facts out there to be gathered, i.e. there is one reality or truth, versus truth and facts are dependent on your viewpoint or somebody else's viewpoint. Such understandings influence what questions you ask and what role you think researchers can and should play. So this is a broad picture of the kind of positivism relativism axis, while recognizing that most people actually occupy some space in the middle. Nobody occupies an extreme, but certain sciences are based more on a positivist understanding that there are a set of facts to be gathered. There exists one reality and that you need to gather a particular set of facts, whereas the social sciences tend to be more focused on reality being constructed by actors drawing on their contexts. So there can be different coexisting realities. This is another way of looking at the same axis, paradigms of knowledge from positivism. So these are all synonyms: relativism, interpretivism, constructivism. Yeah, they all come from different derivations. So relativism is kind of a nod to this thing that reality is contingent, is relative to who is experiencing it. It's contingent on context. Interpretivism suggests that actually the person who is interpreting reality is subject to interpretation, and that could be the interpretation of the person whom you are interviewing. It could also be the interpretation of the researcher. So there are multiple layers of interpretation that take place. So finally what comes on paper and somebody that something reads is actually been filtered through multiple layers. There is an interpretation of reality by the person you have interviewed, then there is an interpretation of that by the person who is researching and analyzing and putting it all together. So that is interpretivism, and constructivism suggests that reality is socially constructed. So it is mediated by human beings, not mechanically derived. Okay, so core differences between the paradigms: single versus multiple realities, that's easy. Reality as being observable and measurable versus reality as social construction. So clearly an observable and measurable reality, truth out there, versus reality as something which is socially manufactured. Knowledge is generated by observation and measurement of facts versus knowledge is generated by interpretations created in interaction between the researcher and respondents. perhaps best summarized in middle range theory. So this again I won't go into detail because we'll be talking about middle range theory in various sessions. And typically positivism follows experimental methodology involving hypothesis testing, whereas relativism, and actually a lot of HPSR comes within this, can be described as this, studying issues in their natural environment. So a lot of it is in vivo. We don't really set up laboratory settings, although there are some efforts, some groups have been trying to set up what they call population labs or experimental health systems labs. But most of HPSR, if you look at the volume, actually happens in natural environment. So the researcher has very little control unless they are part of some intervention which is being rolled out and they're examining that. Often, but even that, there is a lot of lack of control over what can be actually can be determined, predetermined. So a lot of HPSR is studying issues in the natural environment versus experimental methodology involving hypothesis testing. And this is another slide that we've been through already yesterday. These are the various issues, the topics that you can inquire about. So you can talk about, you can do research on hardware issues, HR, finance, medicines, technology, organizations. You can do research on software, ideas, power, relationships. And then you can very interestingly, probably most interesting research is the one that is done on the relationship between software and hardware. So is there when we are talking about human resources, what is the importance of interests, incentives in how people behave, how the health workforce behaves? And that is the really interesting question, the interface between the hardware and the software. And of course, research can be done at different levels, topics encompass local to international arenas. So this is just a quick snapshot, a kind of a vision of how different perspectives can be derived from different disciplines, can give you a different view of human behavior. So you have a machine perspective here, which is another interpretation for, say, a top-down policy perspective, an economics perspective, and a socio-cultural perspective. Each of these have their value, each of these have their place. None is better than the other automatically. So a machine perspective views an organization as clearly defined parts working efficiently together in routinized ways. Machine perspective would look at an organization in this way. It would look at human behavior as being either compliant or non-compliant with organizational changes. So most top-down policymakers would say that, okay, so either people are following the policies or they're not following the policies. And these are the kind of mechanisms that are put into place, formal rules and procedures and authority. An economist would look at it differently. Economists would say, look at organizations as actors engaged in a form of market activities and transactions. So they view each individual as motivated by a particular set of interests, and they are operating within that organization due to those interests. View of human behavior is calculating primarily, although there's a lot of discourse within economics about that. Humans are individualistic and motivated by self-interest. There's a simplistic way of saying it. And these are the coordinating mechanisms. How much you pay people, how much you make them compete with each other, how much you incentivize them in financial and also non-financial ways. On the other hand, a socio-cultural perspective will have a different view of an organization. People who are thinking people, reflective, responsive people forming a complex social system. Human behavior influenced by social networks and relationships. And these are the kind of coordinating mechanisms. Social norms, values, trust, meanings. So the reality is probably a combination of all of these. And that's what HPSR does. It allows you these different approaches to access different types of ways in which human beings behave. But you can see how the view of human behavior can be radically different in different approaches. So the type of knowledge you want to collect will also be different depending on the type of disciplinary approach. So in a socio-cultural perspective, you will try and collect knowledge about social networks and relationships. From an economic perspective, you will try and collect knowledge about the relationship between interests and motivation. And from a machine perspective, you will try and understand why somebody is not following. You will do you'll use words like barriers, you'll use words like obstacles, factors, constraining factors, enabling factors. That's actually machine thinking. Okay, thinking about levels. We already discussed this. Macro level focuses on architectural and oversight issues. Meso level focus on functioning of organizations. Interventions or programs tend to be tracers for the functioning of organizations. And micro level focuses on individual experiences in the system. And also you can do cross level analysis. For example, how do global influences shape the architecture, hence influencing local systems and individuals' behavior. So you can also do research which cuts across these different levels. And run through some methodological considerations, although these are much more specific to the actual capsule or the approach that you will be using. Applied research starts with a topic or a problem. HPSR tends to be applied, starts with a topic or a problem rather than a method. Tends to focus on the real world versus a laboratory, and it is policy relevant. So these are all ways in which HPSR is applied research. Like I said before, there's no gold standard, there's a flat hierarchy, no single methodological gold standard study design. There's a range of study designs or strategies depending on the purpose and the research question that you are seeking to answer. And data collection methods can be either qualitative or quantitative. They can also be combined. Methodology must consider complexity. If the investigator has little control over events, it must accommodate that. The fact that there are numerous interacting elements, systems are open, which adapt, which self-organize. There are different actors with different experiences and different questions. It must recognize that social phenomena are important, such as culture, interests, and leadership. And it must include the importance of contextual influence. So this is a sort of range of study designs or research strategies that you can apply: cross-sectional approaches, longitudinal approaches, experimental approaches, case study approaches, ethnographies, action research. And I've said before, there are a range of philosophies of knowledge or approaches, knowledge approaches that you can apply different paradigms, from positivism to realism to relativism. 4 steps of health policy and systems research: identifying the research focus and questions. The second step, designing the study. The third step, ensuring research quality and rigor. And the fourth step, applying ethical principles. So when we come back, we'll talk a little bit about the research questions. As I discussed earlier, we won't discuss designs explicitly because we'll be covering that over the next 3-4 days. And also there's one of your readings focuses explicitly on HPSR designs. But we will talk a little bit after we talked about questions, we'll talk a little bit about research quality, rigor, and ethics.